Hello and thank you for joining in on today's training. Heart & Solutions is a proud provider of CE-eligible trainings for our counseling community. This training may be eligible for continuing education credit hours through either the National Board for Certified Counselors, provider number 7376, or the Association of Play Therapy, provider number 21-645. To obtain CE hours for today's training, be sure to follow the steps in the description below to find and take your quiz.
Good morning. Good morning. I am Dr. Colleen Grote. I am the Vice President here at Heart & Solutions of our therapy department. And today's training is brought to you guys by Jessica Gilmore, who's one of our behavioral health intervention services providers, and Montana Meyer, who's one of our therapists here at Heart & Solutions. So we are really excited to be able to present this training.
Welcome everybody to the training today. It is about play therapy with children with ADHD. Like Colleen said, I'm Montana. I'm a primarily telehealth therapist here at Heart & Solutions, and I have been working with children and individuals for a few years now. And I see children as young as 5, I believe is the youngest. And so, yeah.
Hi, I'm Jessica Gilmore, and I am a behavior health intervention service provider with my bachelor's in elementary education. I've spent the last 5.5 years teaching in Chicago and decided to transition to a role where I felt like I could best support kids with my skill set. And I also have ADHD, so you will all see that, most likely some of the components throughout the webinar in real life time, but that's a little bit about me.
Right, and today we have a few learning objectives throughout this training, and so we're going to be describing those components of ADHD and kind of just recognizing those effects to functioning that it has on children and what areas we really should be looking for. And we're also going to discuss different assessment tools and what assessment really requires for ADHD, and then further looking at intervention strategies through the play therapy space. Also going to be discussing parent training methods as to coincide with the treatment that you're doing at an individual basis as well. And then lastly, we're going to look at treatment goals, how to define treatment goals, what goals look like for children with ADHD. And so first, we wanted just to kind of ask a couple questions for the group and get you thinking about like ADHD in general. And so just you can put it in the chat, you can speak out if you'd like, but just thinking about what treatments do you most often recommend first for managing ADHD in children when they come to your office?
Emotional regulation, yeah.
All right, and then we had one other question to get you thinking about things. And so how do you stay up to date on those latest ADHD treatment strategies? And like trainings like this today, research, journal articles, where are you getting that information from?
Some other interventions, right? Stop and think type things, impulse control exercises, some executive functioning skills.
All right, and getting into just kind of the background of ADHD. It was first introduced in the 1960s as a diagnosis in the second edition of the DSM. It was originally proposed as a minimal brain dysfunction and thought to peak at the age of 6, but got better over time. They were concluding that it was often not present by adolescents and not coinciding into adulthood. But within those first 30 years of ADHD as a diagnosis, it has changed a lot. And the version that we really know today was first introduced in 1994 in the 4th edition of the DSM, where 3 different presentations of the disorder were established: the predominantly hyperactive, predominantly inattentive, and combined. And it was also the first time that the diagnosis addressed the continuity of symptoms presenting into adolescence as well as adulthood. And since the 1990s, the ADHD diagnosis has climbed rapidly. And so you'll see from this chart that you can see that climb in the diagnosis since the late 90s to 2016. And this graph also highlights the gender disparity within the diagnosis. You can see the darker line represents males with the diagnosis over time, and boys are significantly in a higher percentage, with the current rates being a 2-to-1 ratio in children with boys to girls receiving the diagnosis. And presently, worldwide, ADHD is diagnosed in 5% of children. But in the US, that percentage is a lot closer to 10%, according to the CDC in their reports using data from 2016 to 2019. That percentage is equivalent to 6 million children aged 3 to 17. And so very wide group of people that we're talking about today. And most diagnoses are given during those elementary school age due to, they start attending school. And that is really a space where it highlights those impairments that may come with academic, social functioning. And this image shows those current diagnosis rates as of 2022, which is the most recent data, and this is dividing it per state. And so the prevalence and treatment of ADHD is collected annually through the CDC they use the National Survey of Children's Health, and they've been doing that since 2016. And using these results, which are most current, we can see that the diagnosis varies a lot by different states. And I looked into Iowa specifically, since I'm pretty sure that's where we're all located today. And the state of Iowa is currently at 9.8%, which is a lot higher than that worldwide average of 5%. And I did the math using the 2022 census in Iowa, and that 9.8% is equivalent to 71,000 children. And so that is a lot more kids compared to the amount of providers, and really shows the importance of us as providers, being well-versed in ADHD, as it is such a big population. I further looked into just the results of who's receiving what kind of treatment when they're diagnosed with ADHD in children. And this picture specifically looks at behavior treatment, and they report that in the state of Iowa, only 50.9% of children diagnosed with ADHD have received behavioral treatment within the last year. That is only half. And I also looked at medication treatment, and that was at 70%. And so it seems to kind of lend to the fact that medication is a first defense when it comes to ADHD, and really we're seeing a deficit in that behavior treatment, with only half of the children really receiving that, even though all of us at the beginning kind of stated that behavior treatment is really our first line of defense that we recommend. And just the importance of counselors, needing to offer our services in this way.
So I'm going to talk about the components of ADHD. And when talking about the components of ADHD, typically there are 2 to 3 traits that come to mind: hyperactivity, trouble focusing, impulsivity. And I really liked this graphic because it helps illustrate what sometimes isn't seen or overlooked when it comes to the components of ADHD. The components of ADHD that are shown under the iceberg display just how much ADHD can impact one's life, from emotions, relationships, to making decisions, and so on. So understanding that ADHD encompasses more than just hyperactivity and trouble focusing can better inform our practice and how we support our clients. And this slide is going to give us another perspective from someone who has ADHD and discuss the components and provide us with different examples so we can see how these components feel in everyday life.
Whatever, it's important to remember, behavior is affected by the brain, and ADHD brains develop and function much differently from average or neurotypical brains. Those differences can be valuable, which is why, as someone with ADHD, I wouldn't trade my brain for the world. But without the right support, they can also be incredibly impairing. The struggle is real. It's also invisible, which can make it very hard to see. So to help you understand what it's like inside the brain of your ADHD person, we reached out to our community of ADHD brains, as well as the community at understood.org, to ask how they explain it. For example, fun fact, despite the name, we don't actually have a deficit of attention. When we forget to change the laundry or have trouble focusing in class, it's because our brains have trouble regulating or effectively shifting our attention. So sometimes our brains jump from one thing to the next, and other times our brains actually zero in or hyperfocus on one thing, and it can be hard for us to pull ourselves away. As Eric Peterson puts it, neurotypical brains have a 1 through 10 dial they use to regulate their attention. With ADHD brains, our dials have 2 options: random and 15. And this applies to all aspects of our lives. The ability to regulate attention is part of something called the executive function system. It's kind of like our brain's self-management system, what allows us to plan, prioritize, and sustain effort toward a goal, say, making dinner, without getting sidetracked. It's what allows us to inhibit, or not act on, our impulses and ignore distractions so we can stay on task and switch when it's time to switch. In the ADHD brain, executive functions develop much more slowly than in neurotypical brains. And we have a deficit in the brain chemicals that help them function. So we usually know what to do and have the best intentions, but our executive function system isn't always developed or functioning well enough to effectively help us do it. And it's just as frustrating for us as it is for anyone else. Haley Melville explains it like this. Your brain is like a secretary, and you're the CEO in a meeting, doing a task. In a neurotypical brain, their secretary greets guests, potential distractions, lets them know that the CEO is in a meeting, and either encourages them to make an appointment or shows them the door. My secretary either lets everyone into the meeting or lets no one in, even if it's something important. Another executive function is working memory. That's our ability to temporarily hold information in our head so we can work with it. Like, look at a recipe and then remember the steps while we cook. It's our brain's version of RAM. Everyone has a limited capacity of working memory, but it's often more limited in those with ADHD, which is one reason we might blurt out an answer before we forget it, or ask you to repeat what you just said. Timothy Warnke says, "It's like my brain is a whiteboard, and I have to write down everything that's happening right away. But I write kind of big, so pretty soon I have to erase a bunch of stuff to make more room." By the way, that's also why we tend to have trouble following multi-step directions. It's also why Post-it notes are helpful. Another fun fact about ADHD, not everyone with ADHD is hyperactive, at least not on the outside. ADHD has 3 different presentations, and they can change over time. So even if someone doesn't look like they have ADHD, they still might. Even if they're not bouncing around the room, their brain might be. It's often referred to as internal restlessness, and it's exhausting. Diana DeVader Murray explains her mind like being on a hamster wheel you can't ever get off of. Deborah Cradaville says it's like a pinball machine with the ball constantly hitting and bouncing between all the bumpers. All this energy can be great when we can direct it well. It often shows up as creativity, generosity, curiosity. We tend to think outside the box, and we're 3 times more likely to start our own business. But for us to take advantage of our brain's strengths, it's important that we learn to manage our ADHD.
Okay, so learning at school with ADHD, students with ADHD have different challenges and strengths they add to the culture of their classroom and their school. Some of their challenges are more well-known and were discussed in the previous video, like blurting out, time awareness. And students with ADHD also have different strengths that they bring, and using these strengths to help them interact with the challenges they face with ADHD at school can yield a positive outcome at school. Okay, so this slide displays some of the traits and behaviors students have at different ages and grade levels. And just take a moment and look over the different examples provided at each stage. I'm going to give you all a few moments just to look over each stage. So when looking at all of these challenges students with ADHD face at school, I want us to try and imagine how school could be for us at each stage if we had these challenges and weren't supported. I want us to think about what our school experience would be like, what our relationship with learning would be like, and what would our relationship with school be like, as well as how our relationship with school could impact our life. Because school is intended to mirror parts of adult life, we can see how a child with ADHD could be impacted later in life once they're done with school. Next, we're going to look at how ADHD impacts emotional health. So taking a look at how ADHD impacts emotional health in kids, some important things to note are children with ADHD tend to experience emotions more intensely, and their emotional reaction can last longer. Children with ADHD have trouble with regulating their emotions and then experience an emotional reaction longer and are programming and priming their body to continue to respond in that manner, and it can be harder to change. challenges and differences we see in ADHD brains can often lead to anxiety, depression, mood swings, and feelings of remorse in social interactions. The next slide that I have for us is going to be a video that will help put into perspective how ADHD and emotions interact with one another.
The connection between ADHD and emotional dysregulation. More research needs to be done, but for now, this is what we know. Those of us with ADHD experience normal emotions, as in, it's totally understandable that you got upset when that person insulted you. Most people would. But the way we feel and respond to those emotions can be more intense and last longer than it does for neurotypical brains. Why? Even though we experience normal emotions, our brains have trouble regulating those emotions. The ability to regulate our emotions is what allows us to calm down and make good choices when something gets us worked up. Sounds simple, but emotional self-regulation is actually a pretty complicated 4-part process, and it relies on stuff the ADHD brain tends to have trouble with. First, inhibition, as in not impulsively reacting to an emotion. Not super easy for those of us who are naturally impulsive. In fact, according to Dr. Russell Barkley, the more generally impulsive we are, the more emotionally impulsive we are too. And with that kind of impulsivity, we may not even make it to the next part. 2, self-soothing, the ability to calm down that initial emotion. Most of us do have ways to self-soothe, but they're not always healthy. 3, refocusing our attention. Literally the exact problem that Yep. Moving on. 4, responding in a way that makes sense based on our goals. This shouldn't be too hard, right? We just have to remember what our goals are. Then be able to remember what the other person said, what we wanted to say, how it worked out for us the last time we responded that way, consider all the different variables in this particular situation, and then predict the possible different outcomes based on those responses, and then choose the best action that fits with our goals. Actually, that's a lot for somebody with ADHD. We have limited working memory. This kind of trouble with emotional self-regulation is obviously a problem for things like anger and frustration, and that's a lot of what gets us into trouble at school, work, and in our relationships. But ADHDers experience emotional dysregulation with other emotions too. Sadness, happiness, even fear. It can affect us in ways we may not even realize. As in, we're working on an important assignment, and someone we like texts us. The excitement makes us respond to the text, forget about the assignment, and 5 hours later, that assignment isn't done, even though it's A, really important, and B, due tomorrow.
Okay, with what we know about the components that we've discussed and gone over, how of ADHD, how it affects children at school, and the impact that it has on emotions, we're also going to explore how it can impact relationships. Taking a look at the characteristics between the child and the parent, noting these components that can be present in that relationship, we can consider how that affects both the child and the parent emotionally and can influence the relationship dynamic. If you were a single parent and your child had ADHD, struggled with retaining directions, doing chores, transitioning to school or activities, and needed lots of instant gratification or for things to go their way, how might your relationship look? And that's where we can get to dive in deeper in understanding parent and child relationships. With the relationship between the child and teacher, we can see similarities in behavior with the child with ADHD and their parent. If anyone has any teacher friends, families, members, or has looked at the turnover rate of teachers and or knows how toxic the climate can be in which many teachers educate, keep that in mind. And I'm going to take you all on a short trip to school so we can further kind of consider the relationship between a child and a teacher at school. Imagine you have 30 kids in your class you see Monday through Friday. It's now the English block, and you're beginning your lesson and trying to speak. But every time you ask a question about the lesson, a child repeatedly blurts out the answer before you can call on one of the hands raised. After the lesson, you go over the directions for completing an assignment from the lesson that was just taught. The room is silent as students are returning to their desks, and you have the student who was blurting out tell you they forgot the directions. You explain the directions again, and moments later, the same child asks you about the directions. We're going to fast forward to art class. You've just arrived to pick up your class from art, and the art teacher tells you the same student that was blurting out earlier, forgetting directions on the assignment, was distracting class by blurting out and didn't complete their art assignment. You tell me what happens next. With all the expectations that are placed on teachers trying to support a student with ADHD while you have 29 other students that need support can build a relationship that might adversely affect the student with ADHD because they aren't given the support they need in the classroom. Looking at the last relationship of peer-to-peer, how children with ADHD build relationships with their peers are affected in how they communicate with them, how they listen, and or support their friends in conversations, and also affect their emotional state when faced with these challenges. The next slide is going to show a video that connects the impact ADHD has on emotions and relationships so we can see how things are connected and interact with one another.
This video is going to show the interaction with parents and recognizing the frustration that Jessica's talking about in this.
Let's take a look at what family we've got this week.
Hi, we're the Goins family. I'm Jay.
And I'm Carolee. We have 3 kids. Callan is 6.
That's why I hate my brother so much, because he makes me
You don't
sad.
hate your brother. Colbin is 5.
Whoa.
And Cadence is 2.
Mommy's doing like this, and I do what the kids.
I'm a stay-at-home mom. Stop it. Stop it!
I'm a letter carrier here in the Salt Lake City area. Let me climb up there. Come on. Let's go.
Callan, he's been diagnosed with ADHD.
Alan, we're not doing it. I took it away for a reason.
Hey!
Hey, that is enough.
Shut up, Dad!
What?
He's very unpredictable.
I did not do it!
Calum, we're just talking to you about it.
Anything will set him off.
Hey,
Don't hit me. He swings at me, he'll kick at me, he'll hit me. Don't!
leave her alone. Come on. That was very rude.
Homework is also very frustrating to him. It's not my homework.
I know! Do not help me!
You want to stay in 1st grade? Because of the ADHD, I have a hard time knowing how to discipline him in the proper way.
Fire love me!
Oh boy, Mum looks like she's ready to lose it.
Colbin, he's a character. Most of the time, he's doing something he shouldn't be doing.
That's enough.
A bit of authority wouldn't go amiss, would it now?
Cadence is learning a lot from her brothers, which I do not like. Enough.
Cadence.
Are you mad? What are you doing?
Snack time has been a problem for us. You know, they snack all day long and they continue to do it all day long, but they don't even eat dinner too. It comes to that.
We're not getting a snack right now. We're not getting anything out of the cupboard. Get down. Colbin, you got into the snacks and now you're not eating, so sit down and eat. I feel lost. I feel like we're at a dead end. I don't know where to turn.
No, I didn't! It's lying!
I feel like if I don't get things under control with Callan, then it's gonna lead to more problems.
Downhill!
What is your
From that, you can see that frustration that Mom is talking about, as well as how, you know, it really affects the whole family system and how the siblings interact with each other, how the children are interacting with parents, and just seeing how it all kind of gels together.
I think it's hard in that video too, right? Like to watch his reaction to things, right? Like, yes, Mom is overwhelmed, but when we don't have the proper interventions or support in place, right, for those parents and caregivers and teachers, right? Like you hear him like, I thought you loved me, right? Like that was hard to watch. Like that's on all sides.
Yeah, absolutely.
And Montana, I must have moved the video, but this is the next video that's going to connect.
Hello, brains. Early on in this channel, someone angrily commented that I couldn't have ADHD because I didn't seem very ADHD. That's called editing. It's also called masking. Masking, in a broad sense, is the act of hiding one's true feelings or personality, typically in order to fit in. Masking how we really feel or what our preferences really are is something we all learn to do as children. We pretend that we're happy when we're actually sad, that we're confident when we're actually nervous, that we like something maybe more than we actually like it so that we can fit in with the group we're hanging out with. And pretty much everyone does this sometimes. But for ADHD and autistic brains, fitting in often requires an additional type of masking. For us, masking, verb, is the act of hiding our neurodivergence. And unlike emotions, the way our brains naturally work isn't something that comes and goes. Sometimes we're sad and occasionally we have to pretend that we're not. But it's not like sometimes we're neurodivergent and occasionally we have to pretend we're not. We're always neurodivergent and we often have to pretend that we're not. According to one of the brains, masking is having to watch every single thing that might make me seem not normal and then fix it, having to bottle it up. We mask by making a conscious effort to behave in ways that are neurotypical, like sitting still or making eye contact, or by suppressing behaviors that are common in those of us who are neurodivergent, like stimming, fidgeting, speaking quickly, interrupting while someone is talking, or sitting very strangely in a chair. Why do we do this? We mask to conform to social pressures, to avoid rejection or bullying, and as part of impression management. We're often corrected and even punished for our weird behaviors growing up, and so we learn to suppress them. This kind of social camouflaging can be beneficial. It can help us achieve our goals, like getting a job, or help us establish relationships, especially with people who aren't neurodivergent. In the short term, it can seem to keep us safe. But it turns out the kind of masking that ADHD and autistic brains are often asked to do comes at a cost, especially long term. First, it's distracting. It can be hard to focus on what we're trying to do or trying to learn when we're also having to actively monitor sitting still and making eye contact and responding when it's appropriate to respond. It takes up working memory slots, which we already tend to have fewer of, so there's less of a chance of us actually retaining the information we're being given. It can make it so we don't get the level of support we actually need because it doesn't seem like we need it. This can lead to a delay in diagnosis or misdiagnosis, or more difficulty in getting the level of support we need after diagnosis. It can make it hard for people to believe that we're struggling. Intentionally masking is not the only thing that can hide our struggles, but it definitely contributes. Masking constantly is exhausting, and long-term, it can potentially lead to burnout. It can set false expectations or expectations that we can't consistently meet, which can sometimes make people angry with us, and us angry or embarrassed with ourselves when our mask inevitably starts to slip. It's also lonely. It affects our sense of self and our connection to others if we're constantly having to hide fundamental aspects of who we are. And it's anxiety inducing because a lot of the weird things we do, our brains are having us do for a reason. They're normal for our brains. They're coping and self-regulation mechanisms to help us focus or relieve anxiety, and not being able to do them for an extended period of time is not good for us. And no matter how much we practice that, no matter how long we force ourselves to sit still in meetings to pretend to be neurotypical, we're not going to be. And the world is starting to recognize these differences for what they are. Differences, not deficits or flaws. I'm excited to see this shift in perception. As people start to accept and understand neurodiversity, routinely see unmasked neurodivergent behaviors, and have these behaviors normalized, hopefully we'll feel more comfortable and safe taking off our masks. I want to make this clear though, taking off our masks does not mean that we are absolved of any consequences. We still live in a society with other people, and our actions and behaviors affect others. I shouldn't have to mask doesn't mean I can be a jerk. I'm not advocating for that. But for behaviors that don't hurt anyone, like rocking, playing with fidget toys in a way that's not distracting to others, sitting weird in your chair at work, I really hope.
So that video, I feel like, really just illustrates how everything that we've kind of discussed so far with the components, the effects on school, emotions, relationships, all tie into one another. They're intersectional, they're all connected. And now, with what we've learned about the components, its effects on school, emotions, relationships, I wanted us all to consider how trauma can play a role in children with ADHD. Keeping in mind how trauma can impact the same parts of our life that ADHD does, considering how to incorporate a lens and a knowledge of trauma can influence our practice to better support our clients. And with this consideration, we're recognizing that life is not linear, and nor is ADHD. And this lens can help us be informed and responsive in our practice and working with clients more effectively. So recognizing the signs of trauma and considering how it can interact with ADHD can lead to creating effective systems that help clients who have ADHD and trauma. And the last video that I have for my part of our training will go in depth just how connected ADHD and trauma can be.
It's only somewhat true that ADHD and trauma merely show similar symptoms. For many years, researchers believed that ADHD was genetic or only caused by a change in the brain structure. Science now shows there's a strong association between childhood trauma and adult ADHD. According to a survey, up to 17% of trauma-exposed children meet the ADHD criteria as well. So what is the link between trauma and ADHD? The American Psychological Association defines ADHD, Attention Deficit Hyperactivity Disorder, as a behavioral symptom characterized by 6 or more symptoms categorized as either inattention and/or inactivity. These symptoms usually hinder social, academic, or occupational functioning and begin to appear before the age of 7. While trauma is an emotional response to a disturbing experience resulting in extreme fear, anxiety, or other deep psychological upsets, such as dissociation, helplessness, confusion, and other disruptive feelings. Although we've seen portrayals or have societal notions as to what ADHD is and what it looks like, recent studies point to its correlation to trauma. To truly understand ADHD, we must try to understand where it comes from. However, while comparing both conditions, it's important to understand that in psychology, nothing is black and white, says James M. Greenblatt, MD, Medical Director at Psychiatry Redefined and author of the ADHD book, Finally Focused, meaning that trauma does not directly nor immediately cause ADHD, or not all ADHD is a result of trauma. A 2018 survey conducted by Paul Fruin and his team, Lifetime Traumatic Stressors and Adverse Childhood Experiences, found that many ADHD patients experienced a form of early childhood trauma or trauma suffered in utero. These traumatic events became stressors with long-lasting consequences. In some, the consequences were expressed as ADHD when they reached adulthood. This new study breaks the old thinking that ADHD only expresses itself during early childhood. A 2019 study by Zuning Cheng and colleagues, Associations Between Adverse Childhood Experiences and Health Outcomes in Adults Aged 18 to 59 Years, explains how adverse childhood experiences change the structure and functioning of the brain, making these children more at risk of developing mental or somatic disorders. Because adverse child experiences, also known as ACEs, alter cognitive and affective processing and heighten sensitivity to stimuli, it's no wonder that ACEs can cause ADHD. This study is further backed by a 2017 study that compares ACEs scores and indices to ADHD diagnosis and severity. The study found that children with ADHD had more traumatic experiences in their childhood than other children. Now, to be clear, trauma or ACE does not just encompass physical trauma, but also emotional and sexual trauma, neglect, socioeconomic hardship, familial mental illness, neighborhood violence, and other factors. These researchers found a significant correlation between a traumatic childhood event and the severity of ADHD.
Right. And so now getting into some assessment strategies for children with ADHD. Determining if a child has ADHD is sometimes a complex process. There are many biological and psychological factors that can contribute to symptoms similar to those exhibited in children with ADHD. For example, like you just saw, trauma is a big factor, as well as anxiety, depression, learning disabilities. These all show similar symptoms, and finding those answers to diagnosis can sometimes be complex for us. And in some cases, these other diagnoses may actually be the primary diagnosis, or sometimes they coexist with ADHD, and determining that is sometimes difficult. Thorough history should be taken from parents, caregivers, and the child. And if possible, not always prevalent in everyday situations, but teachers, doctors can also be very helpful tools within that diagnosing stage. It's really imperative to obtain that information from the individuals who observe the child across different settings. And so parents can also, give us some info about what they're hearing from the school, as well as often it's mostly just parent and child interviews that we're more able to do than actually talking to teachers or doctors. And ADHD is a diagnosis where symptoms may or may not be present, depending on situations, that situational variability. They may be, more intense in one situation, or maybe completely not present in another one. For example, situations that are unstructured or boring may elicit a higher degree of symptoms for children. And another critical factor affecting that evaluation process is the increased likelihood that children with ADHD will display occurring problems going on, such as mood or behavior disorders or learning disabilities. Those secondary concerns can also include difficulty with anger management, lying, stealing behaviors, disobedience, peer and family relationship difficulties, as Jessica just explained. A child or even a teen struggling with ADHD can have a significant impact on that family functioning. And so all of this should really be considered throughout that evaluation process. And given that those concerns of children with ADHD go beyond the disorder itself, any assessment, of course, we're going through those primary symptoms in that big book, the DSM, but also looking at behavioral, emotional, social functioning. Where are they struggling? Where do those issues come up most to be able to help them effectively? And equally important is also gaining information through family history about the family dynamics, or family history with parents, siblings, other relatives as well, to provide context for where the symptoms might be manifesting or those connections to things. And this info, I feel like, also serves as a basis for determining how parents or caretakers will be able to implement treatment strategies throughout the treatment process, as you'll learn later throughout this presentation that that family system is really important within the treatment process. And so getting that assessment of the family in the beginning stages kind of gives us a good basis for what's going to work here, what maybe isn't going to work. And so this table is a lot of numbers. And so breaking it down, it is, the evaluation stages, there's a lot of tests for diagnostic tools. And, these are really becoming more and more used, more and more tested to be able to help counselors throughout this complex diagnosis stage, as the evaluation should be really comprehensive and multidimensional to really capture the impact. Ideally, we're doing the interview and kind of the interview with parents and children, but these diagnostic tools are really becoming better and better over time. And so the goal, I'm sorry, I'm tripping over my words today, but this table is the results from a meta-analysis of different studies that look at the effectiveness of those diagnostic tools. And from this, you'll see that the Conners abbreviated symptom questionnaire has really the best combination of positive and negative likelihood ratios. And the Vanderbilt ADHD diagnostic tools with both the parent and teacher rating scales also have moderate sensitivity and specificity in that elementary school age children population. And so these really give us hope, and these can be a very helpful tool. And I know currently I use the Vanderbilt as really a starter step of having those parents fill those out as a start, and then furthering that exploration of things that they marked on that questionnaire to just get a better look at what does it look like, where does it present, what does this really mean for this child individually. And getting into how play therapy and ADHD interact. So these 7 things are really things that we're focusing on in the play therapy space. Like I said, medication has really been that first line of treatment for ADHD for a lot of years, and even still currently. And although medication can be a really helpful tool, it doesn't teach skills, which is really the primary concern when we're talking about therapy with ADHD. Helping them to learn the symptoms, how it impacts their thinking and behaviors, and healthy coping skills to manage those symptoms in their life. I think Jessica's videos really provide a lot of helpful information when you're talking to clients with ADHD, sharing those videos, having them connect with other individuals that experience those same challenges at school, in relationships. So starting off with hyperactivity, many parents reach out for support in helping their child stay on task and sitting still. In the counseling environment, role-playing and going through real-life situations can be really helpful in identifying where hyperactivity or impulsivity may be taking place, or where it's coming up in those interactions. It allows them to process the behaviors as well as their feelings connected to these symptoms when they're coming up in those real life experiences. And they can also go through those and kind of pick out where could a coping skill lie here? Where can we put this in? If we just say use this coping skill, that's really hard for a kid to just use it when they feel like it. And so working in the space together, figuring out where do we put this? What does it look like? And focusing on that learning aspect for them. A common way that this looks is using, toys or puppets to share their experience and really showcase when that impulsivity or hyperactivity takes place in their regular activities. Observing them and guiding them to utilize skills that build their own recognition of symptoms and strategies to help create an action of, thinking before action, or skills of how do I calm down my emotions in this moment. Looking at more of the attention and focus, parents and children themselves have a lot of concerns in this areas with, worries being related to school performance, their future, the ability to be present in spaces like school, recreational activities, their interactions. Play therapy can provide those tools of, mindfulness to develop skills related to focus and bringing them back to the present when their minds feel busy or crowded. More of organization skills, these can be helpful to really affect the effects to functioning for children with ADHD. Things such as, working with them to organize their backpack or homework in a way that makes sense for them, so that they reduce the worry or anxiety about, I'm going to lose this or I'm going to forget this. And really focusing on creating their individual system of routine to set them up for success in completing and remembering where things are and their tasks. Also time management, helping with, their sense of time when completing things. One activity that I personally enjoy when it comes to time management specifically is looking at activities as chunks of time. And so, if I'm going to clean my room, I know it's going to take 20 minutes. And so if I feel up for 20 minutes, I can do a 20-minute task. Other tasks are more of 10 minutes, 5 minutes. And looking at them as chunks of time can really help with that time management aspect. Children with ADHD have very different needs when it comes to organization. They mentally structure their days differently, focusing on really not putting a structure onto them, but finding their structure is something that I lean on greatly. When it comes to social interactions, children with ADHD experience significant social difficulties at times. It is estimated that approximately 50 to 60% of children with ADHD experience rejection by their peers, whereas only 13 to 16% of children without ADHD in elementary school classrooms are experiencing rejection. That is a significant difficulty, going from the teens to more than half. And specific play behaviors have been linked to that resulting rejection. Kids often experience children with ADHD being bossy, intrusive, inflexible, controlling, explosive, argumentative, really noticing that emotional regulation coming out or lack of emotional regulation coming out in those activities, when they are being inattentive during organized games, or maybe violating the rules of the games as well. And in the classroom, those behaviors look a little differently. But those classroom behaviors that are associated with being disliked by peers include being off task or disruptive, disrupting their other peers around them, and they're also getting in trouble with them. Kids don't like to get in trouble. So if I have a friend who constantly gets me in trouble, I don't want to be friends with them, is really the thought process. And so, noticing that those social interactions are really greatly affected in the therapy space, we can practice those social interactions, kind of the same as the other symptoms being directed here, of just practicing giving information, getting that information is really helpful for children with ADHD, just so that they know, as most oftentimes the children don't really know why. Like, why do these people not like me? Or why am I getting in trouble? Because they may not realize what they're doing in the moment. So creating that knowledge as well as self-regulation skills within those practice interactions with yourself can be helpful for when they then put them out into the real world in other interactions. And lastly, self-esteem. Roughly 80% of clients with ADHD also have a comorbid diagnosis, often including depression, anxiety, and which are really affecting self-esteem. And they really sometimes experience the worry and difficult emotions related to a negative self-view, especially around those effects to functioning, including, school performance is a really big one. Worried that they're going to not do well, or that they're not good enough, or not as good as other students because they're getting in trouble, or they're forgetting to bring their homework, and so they get a reduced score. And so self-esteem, I find, is a really core piece to play therapy in children diagnosed with ADHD.
Okay, so I'm going to go over treatment interventions, activities, and techniques I use. I do want you all to keep in mind, though, that because I am a behavior service provider, these examples that I use and I'm going over from my perspective and experience as a BHIS provider, so it might look a little different contextually and how that can play out for you guys while you have our delivering sessions. So during session, I typically limit screen time, and in most sessions I have with clients, there is no screen time. However, when I do use screen time, I incorporate it as a reward or a tool that's going to share information that relates to the goal we're working on, similar to some of the videos that we have in here. For my older clients, or we'll watch short videos that explore how emotions can be portrayed through books. I also use visual aids, and with one of my clients, we have a schedule that we go over and we write out all of our activities for session together. And this has really helped my client with transitioning from one activity to another and planning. And I have found that it's comforting for them to check off what we do with activities. And I've also created some at-home and school schedules that include visuals that I provide to parents, so they can use that with their children outside of session. And role playing with children that have ADHD, I found really helps them prime and program the body and get used to responding in healthy ways when dealing with their emotions and relationships. Role playing has been really helpful in exploring behaviors that happen in everyday life, and a great way to build perspective of the behavior, people involved, and the emotions felt. And one strategy that I've used for role playing is with a family session. I had the client and their parents create different just scenarios that we needed to work on. We put it all in a bowl, and we would pick one, and we would designate roles to people, to participants, and switch the roles to. So my client had experience pretending to be the parent, pretending to be their sister, and just a really fun way to do role playing during session. Mindfulness is another strategy that I use during session. Things like doing yoga, coloring, and meditation are just great ways to build in those coping skills for kids with ADHD to practice outside of session. One activity I use is a meditation script with clients that have ADHD, and it really helps to work on their coping skills when it comes to focusing on my words and ignoring distractions, as that can be prevalent really in any space that kids with ADHD are in. With coloring, I found that is a really easy, simple way that a lot of my clients enjoy, which surprised me. And I like to kind of use that to play on holidays and just explore and build more rapport with my clients. Um, and let's see. Oh, I also have several clients that I complete chores with during session because I'm at their home providing session. And all those clients that I complete chores with have ADHD. As mentioned in previous slides, children with ADHD can really struggle with doing tasks alone. So doing them together can provide more ease with doing tasks alone. And I communicate this information with parents um, to let them know if a child struggles with completing a task or chore alone, just standing next to them can be helpful in that child completing the chore. Task completion is another task completion based activities are another way that I use an intervention with children that have ADHD to work on completing the whole process of something. And it also can implement parts of a process that aren't gratifying or fun to that child. And one that I like to use is a scavenger hunt that relates to my client. It really works with most ages if you're at home. And I'll give them a statement like, find something that represents your personality in your house. And I'll have them put the item away immediately after they show it to me and talk to me about it. And it's just a great way to practice some of those bigger skills in a smaller scale. Most of my clients don't ask for breaks during session, but kids with ADHD, giving them breaks during session can be really helpful with giving them autonomy. Another strategy I have used with my clients is having a free choice session as a reward for meeting their goal. And that's helped a lot of my clients with ADHD remain consistent and working towards their goals outside of session. Um, and a real simple technique I also use with clients that have ADHD is having them repeat and echo directions. Um, and I tell that to parents too, like if your child with ADHD is struggling with remembering directions, be concise, they need to repeat it back to you so you know that they understand what they're being told. I don't have this on here, but another strategy that I use with all my clients, with all clients, is an emotion check-in. And we start that off at every session to help practice identifying emotions that clients are feeling, as well as listening to other participants that are present during session. I have different emotion charts that are child-friendly, and even my oldest client, who's like 13, enjoys them. I have Pikachu, dogs, cats, SpongeBob, and it's just like on a scale of SpongeBob, how are you feeling today? And it's just a nice way to start session and work on some of those skills. Another strategy I don't have listed on here is share and show. And I kind of did a little spin on it from show and tell because I found it to be more and more less prevalent in schools. And it's just a fun way for my clients to find something they want to show to me and talk to me about and explain, and then put the item back as well to work on those skills of completing tasks for kids that have ADHD. And then lastly, a great intervention that I have found that is super helpful with all my clients, including kids with ADHD, is every session I have a parent check-in where we're discussing progress towards goals, new behaviors, or anything that happened during the week that I should be aware of. If I'm not able to have a parent check-in at the beginning of session, I debrief with them afterwards and discuss what activities we did during session to work on that child's goals. And during these check-ins or debriefs I have with parents and guardians, sometimes I'm providing them resources, physical resources, kind of like homework, to encourage my parents to interact with the resource, as it gives not only the child support, but also the parent as well, so they know what to do when they come across these behaviors. I've also found that with those parent check-ins and debriefs, it is a really great way to build consistency for kids with ADHD and rapport, as well as support my client as their provider in a way that is proactive and responsive.
Right. And looking at treatment goals, Jessica talked about a lot of amazing things that go on within the play therapy space. And we're looking at really the goals that we set up at the beginning of treatment, and really uses the same principles that are used to treat other more chronic conditions like asthma, diabetes, and looking at long-term planning. It's very needed because ADHD isn't a curable thing, but I really like taking the perspective of it's about learning your way, your routines, your strategies, and families and individuals, need managing it in an ongoing basis of learning what works for them. In the case of ADHD, schools and other caregivers must also be involved within that managing of symptoms and making sure to have teamwork among everybody in the child's life to keep that consistency, making things work for the child instead of trying to get them to work within a neurotypical boundary or system. And these points here really serve as a framework for establishing a well-rounded and very individualized approach in addressing the unique needs and challenges of children with ADHD. Each child is very different, and goals should be really tailored to their specific needs. And so making sure that plan has really what exactly are we looking for, making sure to be very clear and specific about those goals and target outcomes that we want to see from the child, as well as keeping up on monitoring where they're at, follow-up activities like that homework, which I feel that homework with the children, oftentimes I get I didn't think about it, or I did not do that. And so really having those follow-up activities being in session or with the parents as well, I find is much more beneficial in that space. And when thinking of individualized plans and goal setting, think of SMART goals. They are specific, they are measurable, they are achievable for the child, they're relevant to what you want to see from them, and they are time bound. And so these are really critical aspects in managing, as they really enable a systemic approach to track the child's progress and allow for much easier assessment of their goals and validation when they're achieving their goals. If, I have something that's very specific and measurable, I can see where they're at on it, instead of, those more vague goals where we're working towards something but not quite sure where we're at on that. And so here are some examples of, what those goals would look like within children with ADHD. And so addressing those various symptoms that we've been talking about a lot today, including social deficits, impulsivity, inattention, hyperactivity. And if the child is not achieving these goals, it is really helpful for us as the providers, the clinicians, to assess the following factors about the goals. Were those target outcomes realistic that I set for this child, or was I, setting the bar too high in my expectations? Is there more information needed about the behavior? Am I setting a goal, we're not meeting it, and there seems to be some barrier that I needed more information about what's going on here? Is the diagnosis correct? Like I said before, that diagnostic piece can be sometimes challenging with ADHD, as so many other things can come at play. And is there another condition, whether it be another mental health diagnosis, another medical diagnosis, that may be creating a barrier with some of these goals? And is the treatment plan being followed as well? Is it being followed at home? Or is there, a certain teacher or parent who isn't following this, that's creating those barriers with meeting the treatment plan? And while treatment for ADHD should improve the child's behavior, it may not completely eliminate the symptoms of inattention, hyperactivity, or impulsivity. And I think that's important to address with parents and teachers, like recognizing our goal is not to get rid of this, but rather how do we work with it and around it to help them succeed. And However, if the child isn't meeting those goals and those specific target outcomes, we're the ones who really need to reassess that treatment plan and look at those of, are we setting them up for success as well? And so now to get into some numbers of why play therapy. Today, the combination of medication with evidence-based non-medication interventions has been proven to be the most effective treatment for ADHD. And in this top study that I looked at, they utilized medication and placebo medication to really test the effects of medication in that gold standard of teaching. The small group learning, which is not always applicable in real life scenarios. As Jessica explained earlier, sometimes you have 30 kids and they're not getting that attention they really need for support. And so this was those small group instruction. And they found that medication did have a very significant effect on the academic seat work productivity and their classroom behaviors every single day that they were in this instruction period. However, there was no effect of medication on learning the material taught during the instruction. Children learned the same amount of subject area and vocabulary content, whether they were taking stimulant medication or a placebo medication. And so I bring this up because I feel like it's really important to recognize that stimulants for ADHD are really similar to antidepressants for depression. They really assist in reducing those surface level symptoms of, sitting still and the focus, but they don't address those long-term effects of school performance, social deficits, emotional health. And so really focusing on medication can be helpful, but that play therapy is very much needed to really look at those long-term effects. And the second photo from down here, again, a lot of numbers to look at, but it was a study done on the effectiveness of play therapy for children with ADHD. And as you can see from this breakdown of pre and post play therapy tests of their symptoms, the assessment was the Vanderbilt with parents and teachers, as well as the Children's Symptom Inventory Rating Scale for parents and teachers is what they used to come up with these numbers. And overall, they saw that play therapy reduced each of those primary concerns related to ADHD. And these effects are applicable to both boys and girls, as well as younger and older children. And so it really concluded that applying play therapy had a positive effect on paying attention, decreasing hyperactivity, and controlling impulsive behavior of children with ADHD. There was also statistically significant differences in children's emotional and behavioral health, recognizing, positive interactions with their emotional regulation, as well as reducing fear and anxiety levels, was kind of a side effect of play therapy in a beneficial way. And as me and Jessica as well have mentioned, parent training is a really big aspect of the treatment for children with ADHD. And when parents become trained in behavioral strategies, they learn skills to help their child succeed at school, at home, and in their relationships. Learning and practicing strategies requires time and effort, but it has lasting benefits for the child and family. And so the three core difficulties with ADHD that really affect parenting are that self-regulation within the child, being able to emotionally regulate on your own. Children with ADHD are often, regulating because of their environment. And so having parents become a part of that environment in a positive way. They also experience inconsistent behaviors. Parents often struggle with one day their child can get themselves ready on time, maybe early, and they complete all of those tasks within a routine, great, one day. And then the next day they need help every step of the way, having difficulty, with being consistent in their routines. One day they may be really motivated, one day they just may feel very bored by that routine. And children with ADHD also have different responses to rewards and consequences. They often get bored of using those same rewards and consequences over and over, but they have really big reactions to when things are first used. I see a lot of parents get very, very excited when we start using a new strategy with their child, of a reward system or some, new routine or fun activity. They seem really excited because their kid is very into it, very excited about it. But then a week later, it doesn't work. There's more conflict going on. Nobody wants to do it anymore, and very just up and down when we're trying to just do the same thing over and over. And so what we want to teach parents is to aim. So to anticipate, increase feedback, and motivate with rewards. So in that anticipate aspect, a child with ADHD is not well versed in seeing themselves forward in time, predicting what would happen if they do certain things. So we as the adults, really having them anticipate which situations are going to be difficult for my child, which situations are going to be a trigger for certain behaviors, maybe some tasks at certain points of the day where my child gets distracted every single time, and building in kind of those cushions of support, increasing the parent support, teacher support, creating more structure, more rewards or consequences that are already laid out beforehand, so it doesn't feel as much of like cleaning up a mess at the end or being frazzled when things fall apart. And also increasing their feedback with the child. With difficulties with self-regulation, they rely on that environment to regulate themselves. And so teaching parents to become a positive piece in the environment, including more positive praise, more positive attention than correction. One thing that I find helpful is jumping in when things are going well, when things are happening. Oftentimes parents are used to giving that feedback positively when things are all completed. And so instead taking the approach of jump in when they start an activity, jump in if they're just keeping going with an activity, and just putting in those more positive feedbacks, not just at completion, but throughout the tasks that you want them to be doing, so that you can tell them that they're on the right track, and then they can keep themselves going if they're getting that positive feedback. But corrections and redirections are still needed, more than the average child with children with ADHD. Those corrections are still going to be needed, especially if you're setting up new routines, or even just doing the routine of homework and brushing your teeth, things like that. And so we want to approach these in a way that doesn't send just negative feedback after negative feedback, but keeping from making them feel defeated or that they're not doing a good job, but providing corrections in a positive way of I see that, you're not doing this. Why don't we do this together instead of you should be doing this and you should be doing that. Just changing that language slightly to create a more positive environment of support rather than just negative feedback. And motivating with rewards, as I mentioned, those rewards can have a lot of ups and downs with them. And so teaching parents to establish consequence systems, as natural consequences don't really have the effect that we would expect. For example, if my child is forgetting to wear socks every day, the natural consequence that we would expect is, well, their feet are going to get cold during recess. But for a child with ADHD, the consequence is coming too far apart from the behavior. And so that connection may not be made. And so motivating with rewards and establishing consequences that are more directly linked with cause and effect is really beneficial. And really enforcing those consequences directly, as well as exploring, the interests of the child when we're thinking of rewards and consequences. What excites them? I always like to think of it as what's their currency that they deal in, whether it's a screen time, coloring, whatever, things that they may really hold tightly to, using that in a way that's positive with them, of, boring parts of the day. One thing that, I found helpful in recommending it is really looking at like bedtime or morning routines and putting in something exciting. Like maybe my child and I do a story time at bedtime, because there's nothing exciting about laying in bed and going to sleep. And so let's make it exciting, or something that they want to do at the end of the day. Or maybe we just have a dance party while we're brushing our teeth. Like, let's make it exciting for them so that they can be excited about doing those things that are normally boring parts of our day. And this next video is a resource that I really like to send to parents, that when a new diagnosis is made for ADHD, I feel that it sets us off on a good foundation of the process of what really is needed from the parents during, creating this plan for their child. And yeah, we'll just watch it.
I want you to imagine this. The race is about to start. You grip the steering wheel of your bright red race car. You rev the engine again and your excitement rises as you see all the other race cars lined up. Gun fires and you're off. And as you near the turn, you pump the brakes. But nothing happens. Panic instantly rises as you see the other cars beginning to brake to make the turn. But you're having trouble controlling your car around the turn. You're trying, but your brakes just aren't powerful enough for your car and you slide off the racetrack. This is what it's like for people with ADHD. Like Dr. Edward Hallowell describes, it's like having a Ferrari brain with bicycle brakes. The brain is wired in a way where self-control and regulation are truly more difficult. Those race car brains need great mechanics to strengthen and rebuild those brakes so they're a better match. And that's what we're going to focus on in this video. How parents can be great mechanics and use a few big ideas to better help kids with ADHD at home. So my first big idea of how to help kids with ADHD at home is to understand and manage your expectations. Do your best to fully understand the child's specific ADHD symptoms and how they affect their life at school, at home, with friends. And then with that understanding, do your best to have realistic expectations as a parent. ADHD affects 1 in every 15 to 20 kids, and it may look different in every child because there are actually 3 different ADHD presentations: inattentive, hyperactive, and a combination of the two. It's not just about sitting still and having trouble focusing. People with ADHD have brains that work differently and genuinely have a harder time with self-regulation and self-control, whether that's with things they say or do, or with emotions, or working toward a goal and ignoring distractions. Knowing which behaviors for that specific child are really driven by that race car ADHD brain will help you know what to work on to strengthen those brakes. Continually remind yourself of the behaviors that are really driven by a brain that works differently. This will help you have more accurate expectations, give you more perspective, more empathy, and help you manage your own frustrations with ADHD. The second big idea of how to help kids with ADHD at home is to take care of yourself first. Parents of kids with ADHD will get frustrated with the ADHD a lot. So as the race car mechanic, you need to make sure you have the resources and are strong to work on what's needed. And the only way you're going to be able to do that, to be the successful mechanic, is to take care of yourself first. ADHD is a neurodevelopmental disorder. It's generally not something kids will outgrow, although they can learn to manage their symptoms better over time. And it is so hard to help a child who's having long-term struggles when you're having them too. Think about playing the long game. You are in this for the long haul. You cannot afford to be burned out all the time. Now, of course, parents have hard days and big reactions and feelings too, but you need to make sure that you're continually filling yourself up and taking time off. So yes, this includes prioritizing basic things like getting enough sleep and exercise and good nutrition and some social support. By the way, if any of those things are tough for you for whatever reason, please find some time to pause and think about what kind of changes your life needs so you can have a system that runs better and more efficiently to get your own needs met. Not only will it be easier to parent a child with ADHD, but you'll also be a good model for them, and they need to learn those basics of taking care of themselves too. By the way, if you found this video helpful so far, let me know by tapping the like button. It'll help it spread to more families who need it. And back to the idea of taking care of yourself first, it isn't only about these basic things of healthy eating and sleep and exercise. It's also about figuring out which parts of the ADHD are hardest or most frustrating as a parent, and creating a specific plan for how you can approach those in a better way. Like if you're a parent that gets easily overstimulated by noise, like me, use a timer for a talkative kid where they hold their questions or things they want to tell you for 5 minutes. Have them write them down or draw pictures so they don't forget what they want to say, because forgetting and remembering things in their mind is hard for kids with ADHD. Also, if you have a really talkative kid, one who asks a lot of questions, you can start with just 1 or 2 minutes and work your way up to 5. Or for example, if you have a kid who has a lot of energy, so they climb or jump on things that aren't the safest and that spikes your anxiety, create a safer space in your home where you don't have to intervene. Hopper balls or mini trampolines can be great small indoor items, or swings or bikes or scooters can be great for outside. I'll put a link in the description to a few of my favorite items for getting energy out. So after you've begun to manage your expectations and have some good systems in place for yourself, another big idea of how to help kids with ADHD at home is to focus on the positive. Now, I don't mean build them up with positive stuff in a fluffy unicorns and rainbows kind of way. I'm talking about the stuff that's going well, the child's specific strengths and interests. Focusing on the positive is really important, especially for kids with ADHD, and I felt it deserves more attention on its own. So to see exactly what I mean and how to put this big idea into practice, check out the next video below. It'll give you specific examples of what to say and how. I want you to imagine this.
So from that video, you can see how, it really sets parents up for looking at their expectations of what's needed from them. And I really appreciate that video a lot, because I think it shows how the parents are just as important as the child throughout the process, which I don't think most parents expect when you think of, the parent training aspect of it and how ADHD impacts that family system. And so it also kind of validates their emotions and the frustration or worries that they might feel, and how taking care of themselves is just as important for taking care of their child. And so one, parent training strategy that I wanted to bring up today is psychoeducation about accountability and shifts in kind of how we look at consequences. I like to start by educating parents on why punishments don't work for children with ADHD. Validating their frustration in this aspect, as they will probably have seen that punishments are not working consistently. Really focusing on that episodic memory, future thinking skills, punishment reactivity, or adversity, it should say adversity on there, and reactivity of kind of how that's all impacting when they're using punishments. Like this stuff is kind of creating a barrier that kids aren't connecting those dots. And then exploring those accountability techniques with them, explaining, how it's going to be different, and really exploring and giving examples of what is it actually going to look like. Not just talking in vague terms of we need to be, having more accountability, less punishment, because that's very confusing for a parent who already has so much other stuff going on. And so, going through giving those concrete examples of exploring how to change their language in the moment. And so these two aspects on the right that you're seeing are two aspects that I really like to focus on when speaking about accountability versus punishment. And the first is really creating that culture of accountability at home, recognizing, let's look deeper at the rules that the household has set, and focusing on how each person is really responsible for themselves and how they respond to things. And that includes parents, other caregivers in the home, other siblings, really giving those same rules to everyone. As I find that if you isolate a child with ADHD and their accountability, it's very confusing, because why do these same rules not apply to everyone else here? And also focusing on the language of accountability, and how we use our words is very powerful. And so using that language of direct causality, like I spoke about before, to create that accountability and difference different thinking of consequences. So since you did X, now Y is happening, and focusing on that causality that may otherwise be missed with children with ADHD. And, as the provider, these, 5 things are really important aspects of our job to provide when thinking of the family aspect to treatment. With the family, these sessions can be really helpful as parent-only or family sessions. I do think it's beneficial, if possible, in your space to do those parent-only sessions, as I find that sometimes parents need a space to download that frustration and that may be coming up for them, whether it's just frustration with their child or frustration with maybe some of the strategies that we're using. I really appreciate getting that feedback on those, because not everything is going to work for every family. And so making sure to get feedback on what's working, how is it working, with those activities that you're assigning to parents to practice and with their child, and being able to provide support to them. So it's really about the teamwork beyond just us treating the child, but teamwork within the family as well. And one aspect that we wanted to bring up today, since I am a telehealth provider and Jessica sees individuals in their home, we thought we had kind of special aspects to looking at play therapy. And so I wanted to talk a little bit about telehealth sessions, just looking at the pros and cons. Telehealth has become much more widely used, expanding even more rapidly since COVID. And oftentimes, looking at the research of more and more telehealth, there's really similar results to the success in treatment as traditional in-office sessions and those telehealth sessions. And I looked at a meta-analysis of studies researching the effectiveness of telehealth therapy services specifically for children with ADHD. And it showed that children's symptoms did improve, and telehealth was very comparable to in-person delivery for both parent skill training and child behaviors. Those benefits of telehealth include reaching underserved populations in remote areas. Being in Iowa, we have a lot of rural communities. I myself am from a town of around 200-300 people. We don't have any mental health resources. We don't even have a grocery store, to be honest with you. And so really these populations are difficult to reach with that traditional in-office delivery of services. And telehealth has vastly, promoted the accessibility and as well as convenience of services. As any, driving time is also a commitment, whether we're 15 minutes from an office or 40 minutes. It's a commitment to go to those in-person sessions. And so telehealth can also be a convenient way for individuals to participate in services. One thing that I found with doing telehealth sessions is that clients often do sessions from their home, and it's a place where they are familiar with and they're very comfortable in to begin with. And this provides kind of what I see as like a safety blanket for clients. They're in a safe place already, and it can be a lot safer to explore those difficult emotions and topics rather than in a space that's not theirs. And it just, like, they're easily accessible to things that they already use to emotionally regulate, or a place where they just feel more comfortable. And as a clinician, especially with children, I find this understanding in a different way one very beneficial. Oftentimes clients are in their rooms, and with children with ADHD, they love their stuff and playing with their stuff during our sessions. And I think seeing their room, how is it organized? What kind of stuff is in there? Just what does it look like? Provides so much more understanding to them in a much different way than that traditional in-office setting. And I think that exploring their own toys or games or things that they have can provide a level of rapport that's already kind of there. Kids love to show me their new toys or games that they get, or things that they're just really into at the time. And we're able to build a lot of rapport in that way. And even though the increase in telehealth services has opened up a lot of new avenues for seeking services, it still has its challenges to navigate. Body language is a great part of what builds rapport in the therapy space, in those relationships. In telehealth, we often only see shoulders up, is mostly what we see, sometimes more with kids if they're playing around, but we don't really get that same effect as being in person with somebody for the relationship. And so it's really about adapting to it. Like I said, I build a lot of rapport just in engaging what they are getting into with kids. You know, really tell me about the new game that you got. Show me about how this toy works that you got, and building rapport through that, validation, that active listening, and maintaining eye contact are really much more significant in telehealth sessions for building that same relationship. Privacy is also something that comes up in telehealth sessions, making sure with parents and their children to establish very clear boundaries of our sessions, being in a confidential space alone so that they feel the same sense of security and privacy as they would coming into an office. You know, with children with ADHD, they often want to be up and about and exploring new things. And so setting up those expectations and being very clear about what's safe and what's not safe while you're on video with me is really important. You know, I have some kids who want to go outside, but they live in a busy neighborhood, and so we can't do that. And so we do safety checks. You know, is going outside going to be safe for you? Are you still going to be alone? Is anybody going to hear you? And if somebody's going to hear you, that means it's unsafe, and we should just find a different room to go to. Things like that. Internet connection is a big factor. Reliability with internet is sometimes difficult. As you can see, even my computer was taking a little bit to load today. And so, you know, really making sure to have reliability on our ends, but internet goes both ways, and sometimes you will experience lag or disconnection during services. And so making sure to have a plan in place if that disconnection occurs. Sometimes I find that we'll be interrupting each other, and so I take a couple more seconds to pause, especially with children who may pause when they're speaking or may need a second to think before they know what they're going to say, and just pausing before responding to them to make sure we're not interrupting or they don't feel interrupted in any way. And if we get disconnected, having a plan. Are we going to reconnect? How many minutes are we going to wait until I give them a phone call before waiting for them to reconnect? Can we go to a phone call based on, you know, the boundaries around it? You know, having all of that done already ahead of time to make sure we can be confident if any of that ever happens. And with children with ADHD, a big struggle I run into is that symptom of distractibility. Kids may be doing something on the side while we're in telehealth. They may be playing a game or drawing, or sometimes even looking up things online while in session. And all of that affects the therapy session a lot. But they may not even be aware that they're doing it as well. Like they may be just randomly drawing something and they don't really realize that it's impacting our space. And so recognizing that and working around that. Oftentimes I just ask, like, hey, show me what you're doing, like get me involved in what you're doing. You know, maybe our conversation is boring to them or it's something that they don't really want to talk about. And so their mind is going elsewhere, and just using that as more knowledge and being able to, you know, have that interaction with them if something is happening. We also don't have the same tools that we do as in office. We lose that control over the types of toys, how many toys may be available for children to use. This creates a little difficulty and requires a lot of flexibility as a telehealth counselor with children. But I think there's a lot of resources out there to make up for this gap between the two. And, using the children's toys, like I said, I find that it actually is a benefit at times of creating rapport and comfortability for the child using their own tools and toys or games, whatever it may be. But also using things like online games, online toys, kind of like I have like an online dollhouse, is amazing because it's just like we'd be in person. It has people, animals, things. It has a lot of stuff in it, maybe even more than I would have a dollhouse in real life. And so really just finding those tools to lessen the gap between the tools we use in person and tools that would be online.
Okay, I'm going to go over the pros and cons of working in person with my clients in the role as a behavioral health intervention service provider. So if we're having session at home, and there will be a lot of parallels to what Montana said in my explanation as well. If we're having session at home, Montana mentioned it helps my clients feel comfortable. We have access to materials or items that my client interacts with frequently. And so, again, that mirrors parts of their everyday life that we can then immediately interact with as we're in person. And I can facilitate and direct how we interact with those things. If the session is in home, which 99% of my clients I see in home, we can work towards their goal in a real life setting. So with my clients that have ADHD, a lot of them we're working with how to interact with siblings and parents that are respectful and healthy, and creating positive relationships with immediate family. And at home, I can help my client who has ADHD with chores and tasks and really structure a session that relates to the goals that we're working on outside of session. We can also dive deeper into those tasks or activities that we do together. I've talked with my client before. They said, "Oh, it's just so much easier to get the chore done when you're here." And he has ADHD. So we talked about that. What makes it easier for me to be present? And we can just dive deeper into some of those experiences that kids with ADHD have, and they're not quite sure why. At the end of each session that I have in person, I have a goal that the child is working on outside of session, and we've practiced that during session. And being home with my clients, we're able to interact with those goals and make them effective as possible and trying to carry them out. I found that children with ADHD, it's very helpful that we're practicing it during session, creating a goal that relates exactly to, very similarly to anything we practice in session, for them to do outside of session. With in person, I also have more parent involvement because I can directly communicate with my parents through debriefs or check ins. And this has helped with working as a team to be effective and cohesive in how we support their child with ADHD. Being in person too also allows my parents to see strategies I use in session when session is over and how they can practice them outside of session. Within person, I like providing the support and connecting parents and bringing them in, like we talked about with parent accountability. So my session isn't just a session for the child. And being in person also reinforces why I'm there. Oftentimes, I'm able to work as a liaison with my experience of having a teaching background and working with kids to help bridge kind of that gap of that can be sometimes parents looking through a parent lens, a child's looking through a child lens, and connecting them so they can both feel heard and understood, and we can make progress in changing those behaviors and understanding them better. Um, my relationship and purpose of having sessions with my clients are to support them as well as their parents, and in-person session really allows me to do that. It also provides clarification to my parents because oftentimes I get told or have my parents talk about me like, "Oh, so and so is in session right now with their therapist," and I'm like, I can kind of more directly explain my role and explain the difference between a counselor and a BHIS provider and what I'm doing and how it helps their child with ADHD. I had a guardian tell another BHIS provider that we were essentially glorified babysitters. And being in person, I can remind my parent and guardian of the role of why I'm there and that accountability piece as well of how much they should be involved in session. With in-person sessions, I can interact a lot more effectively with clients as I can observe those nonverbal cues. We can discuss the nonverbal cues if needed, and that gives us another layer in our session. With nonverbal cues, they're so helpful in just seeing if a child needs a break or just another need that they have, and we can meet that together during session. It also really helps build rapport. I can connect with my clients that have ADHD in a way that is personal and become another adult in their life they feel safe and supported by. Going back to the video with ADHD and trauma and ACEs score, one of the huge impacts that can change an ACE score and how children interact with those traumas is having a safe adult that they are supported by and they trust. And being in person really allows me to do that. I get to know the interests of my clients and the personalities of them, and having in-person sessions with my kids that have ADHD allows them to take off their mask and be their authentic self because we're at home, we're at a space where we're comfortable together. So those are a lot of the pros that I found. With some of the cons, there are a few. Sometimes there's scheduling conflicts, and I've found that if we're meeting in person, and it's not a I'm just drawing a conclusion here, but it can seem that parents find it easier to cancel if they aren't feeling like having session or having someone come over and spend time in their home. So that's a con with scheduling of the parent feeling like, they have to mask a little bit, they have to clean up their home, or just kind of prep for somebody to come into their home. And when I first meet a client and their family, I imagine they feel a little bit uncomfortable with having a stranger in their home in a space that is very, close knit and a reflection of who they are. I would say with sessions at home, there can be more distractions, like Montana mentioned, especially kids with ADHD. But I would say that's also can be a pro too, because it helps me help them figure out how we can interact with those distractions. But so it's kind of a pro and a con at the same time. I will say another in-person con can be safety concerns. I am in the home. I get pretty close as professionally as I can with my clients and their families. And during some sessions, I know that in the past there have been safety concerns where we are observing a family dynamic that's a safety concern for parties, myself, as well as seeing if there are huge triggers or explosive behaviors that happen during a session where it can be a big safety concern for a provider. I recently had a client who was having this huge emotional reaction. He has ADHD, ODD as well, and very much so triggered. And it had a very physical reaction that was affecting my safety as a provider in their home. So those are just a few of the cons that I found, and a lot of pros with having in-person sessions.
Yeah, ADHD is becoming more and more researched as the diagnosis has been growing in those children population since it was first seen. And really it affects, we've looked today at so many effects of their life, creating frustrations for themselves, the family system, which really those impacts of, social, academic, emotional functioning, all can be addressed through, those interventions in play therapy that we spoke about today. We've gone through a lot of specific strategies for treatment of ADHD in children, the creation of SMART goals, the importance of parent training, teaching parents to aim as a really core piece of creating that consistency of the treatments that we use with the children. And really overall today, just recognizing that play therapy is a very effective evidence-based treatment, which can be utilized in both in-office, those in-home with BHIS, and or telehealth modalities. We left some time for questions today. If anybody has any questions, you can feel free to speak out, put them in the chat, whatever you're comfortable with.
Questions on a Friday morning, it's tough, right? And you guys did a great job explaining so much great information. So thank you both very much. Yeah, I'm checking the chat. I don't see anything coming through, but if anybody has anything, please don't hesitate.
I do have a question. Just in regards to the data that you had in the beginning about the like the 2-to-1 ratio with boys versus girls. And so I was just wondering if you've come across any data that tells like if the girls are not being diagnosed with ADHD, like what are they typically being diagnosed with, if those are kind of misdiagnoses? Just curious.
Yeah, I really appreciate that question. So I haven't found any specific data about it other than, it feels like it really goes missed, as I feel that, there are so many, gender differences between just in like a cultural sense of, boys and girls, and kind of having those boundaries or boxes of expectations of different genders as they're growing up. And I found some like journal articles that really discuss that aspect of it, like the cultural impact to diagnoses and how, girls are really kind of sent those messages from a young age of, sit still, be quiet. And like, it's very interesting how the cultural impact affects diagnosis as well, but haven't specifically looked at like, are there other diagnoses being given or is it just being missed? But I appreciate that question.
Thank you.
Another question that came up, right, is how in private practice do you manage parent-only sessions with private or other insurances that won't allow the 90846 code?
I can answer this one. So I definitely understand the frustration with insurance that does not allow for those parent-only sessions. One thing that I like to do is actually very similar to what Jessica mentioned in doing a session, with the child, and then just having like even 10-15 minutes at the end with parents only, so that it's like we get that time for a check-in, but it's not a parent-only session. Or also doing those family sessions, having emails with things as well, different strategies to try to work around that insurance barrier.
That was my question. So I want to follow up on that. What about if you need the parent, like you need the child not to be there? Because sometimes I, like with certain ages, I can send them to the waiting area, but sometimes like there's a concern of like with their really young kids. So that's, I guess, kind of also my concern is like when you want the child not to be present for part of those, how you manage that.
Yeah, Montana, I can let you answer. I can help as well.
No, I'm a telehealth provider, and so if you're talking in office, I feel like Colleen may be a better resource for that.
Yeah, it's definitely, like Montana said, it's definitely a huge challenge, right? In a perfect world, it's like, just let us do the work that we need to do the way that we know we clinically need to do it, but working through those insurance challenges. And so to make sure that we are practicing, ethically and legally and all of those things, and kind of having, okay, the caregiver's present, but I need a few minutes and I can't send the kid out to the waiting room on their own, is when we really have to kind of pool that caregiver support systems and really kind of plan ahead for, okay, can somebody else come to this session with you who then takes the child, at the end of the session, and they either go to the waiting room together or the car together or whatever that may be. And that's not ideal by any means, but really making sure that we are kind of finding a way to still have that child presence enough that we can bill for that session the correct way and then get some time. And also explaining, I think, from the very jump at intakes with caregivers of, look, this is the limitations of insurance, right? And we never pretend to understand individual insurance. We do our best. We're fortunate enough here to have a wonderful billing team who will look into it and kind of give them a heads up. But, letting them know, look, I do know that Blue Cross Blue Shield, for example, right, won't cover a parent-only session at all. And so here's what we're going to have to do to be mindful of that and work through that, and really just kind of do our best to work in those parameters that are not ideal. Their other option, obviously, is always to do like a private pay, session or something like that, which unfortunately isn't typically accessible to clients either. There's no great answer, right? I wish there was, but the other thing, and I don't know if your agency has BHIS, right? But we have had some situations in the past, especially with families with multiple children, right? And things like that, where BHIS has happened in office, and we've been able to make a transition like to the BHIS provider following the therapy session. So they're still with a safe provider. Any other questions today?
I know you already kind of mentioned some different strategies for telehealth only play, but any other kind of suggestions for engagement? I find that I'm supervising someone who's having a lot of difficulty with that engagement. And obviously we've gone through like the list of like play, like games and things like that, but just having a hard time with like keeping the child in the screen, which I feel like we see this a lot with kids with ADHD. So any other like suggestions or any other kind of tools that you feel like have been more successful than others with telehealth play specific?
Yeah, you are absolutely. That is a great question, because keeping them on the screen sometimes can be difficult. Absolutely. And so one thing that I feel is helpful is I'd like to do activities where they're like bringing things to me and like explaining it to me. And I feel like it really helps with like building their confidence around things. Like, go grab something that's really important to you. Like, tell me about why it's important. How does it work? And like really just being super curious about everything that they're bringing to you. But like having them like teaching you things, I find really keeps them engaged. For example, like I've had children teach me a lot of things, like things about animals, the pets that they have. I learned how to cast out a fishing like rod, doing those things that really attacks that self-esteem goal of like building competency skills in their teaching as well.
Thank you. Sorry to monopolize, but can I ask another question?
Of course.
Did you see any research on the efficacy of play therapy with telehealth? Because I feel like we get a lot of pushback on how play therapy is effective with telehealth. And I'm just curious as to what like research is out there for that, or if you saw any.
Yeah, I looked in, there's not as much as there really should be. I could only find a few like articles specifically when it comes to play therapy. And most of what I saw in there was that like play therapy specifically was with ADHD specifically was very similar to in office, and I didn't recognize any like barriers or like a negative sides of it. It was a lot of positive about telehealth with play therapy with ADHD in particular. I didn't widen the scope for today's purposes, but there's really not that much out there, and I wish that there was more.
Yeah, it's definitely an emerging field, obviously, in the last couple of years. Primarily, there is some information out there. There is information from some of the newer studies that do tell us that done appropriately, effectively, that it can be just as effective. And so there, like Montana said, the research is limited, but there is some new articles, and not to go into infomercial mode here as well, but we do have some previous webinars that are recorded that are on that topic specifically, and we have some more coming up for 2024. But yeah, because it's an ever growing and continual need to kind of figure out, okay, how do we engage all clients, but especially those with a diagnosis such as ADHD, in that telehealth presentation. So
I was also going to add on really quickly to, there was a question or a comment of a child taking telehealth in a counselor's office at school and not having access to any personal items and suggestions. So when I was teaching during COVID, we had a lot of these same problems with telehealth that are present now, of how do we keep our kids, our students engaged when we're spending time together. And there are a few online sites that I've found that are fun, that can target different skills. There's some activities that are like Jeopardy that are fun. There is Kahoot and this other site called Look It. You can work on different skills with your clients that have ADHD. I'm trying to think of what else. Sometimes YouTube videos too can be a resource that can lead an activity. So I would consider those, try to explore some of those. A lot of good information is also on Teachers Pay Teachers, even though it's for teachers, but it might provide, there's a lot of SEL stuff on there too that might be tailored toward activities that you can do remotely.
Wonderful. If anybody has any other questions, please feel free to reach out. If anybody, you shouldn't, but if anybody has any issues accessing that post-test or getting their certificate, please let us know. But things should be up and running just fine.
Thank you for joining in on today's training. We look forward to having you join us again. Heart & Solutions is proud to provide CE-eligible trainings for our counseling community. This training may be eligible for continuing education credit hours through either the National Board for Certified Counselors, provider number 7376, or the Association of Play Therapy, provider number 21-645. To obtain CE hours for today's training, be sure to follow the steps in the description below.